All right, new at midday, the FDA authorized COVID vaccines for infants and preschoolers. The CDC advisory panel and CDC director, Rochelle Walensky, will likely sign off between tonight and tomorrow, meaning children 6 months to 5 years can start getting COVID vaccines by Tuesday. I want to bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Dr. Winter, it is good to see you and good to bring this news to you. COVID vaccines and kids, this is something to consider. Not just one shot, so it's going to be multiple shots. And pediatricians say you can get it at the same time as other vaccines for your kids.
Yeah, that's true. These 2 shots hopefully be approved tomorrow by the CDC. And then out next week, we hope. It may take a while to get the distribution out there, but they work very, very well. Both Moderna and Pfizer are approved. Moderna is 2 shots a month apart. Pfizer's 3 shots over 11 weeks. Both of these in the studies had no serious illnesses, no deaths at all, and they did lower the chance of getting COVID in these young kids in the trials. So welcome. A lot of mothers will be very happy. These will be available hopefully very, very soon.
Yeah, at pediatricians' offices, perhaps at some pharmacies, not all. That's something important to note as well. Dr. Winter, no masks required when we're flying, no testing to re-enter the United States for international travelers, but people are on the move for summer travel. So how can we control further spread of COVID at this point? What do you recommend?
I think it's a great question. COVID's still out there. In fact, it's been going up, as you know, Sonia, the last couple of weeks, the last month, in fact, it's been going up. It's still out there. Now, they're not saying you can't wear a mask. You can wear a mask, of course. Masks do work to prevent the spread of COVID. So if you're in crowds, if you're in an airport, if you're on an airplane, I think if you want to be safe, you ought to be wearing a mask.
Yeah, that's what I've been doing. And cases are going up. I'm getting a lot of calls and texts and messages from people I know who have COVID. We do have one viewer question for you. If you test positive at this point, how long should you isolate before going back to work and getting sort of back to life? Is it still 10 days? Is it until you test negative? What's your suggestion?
Yeah, the problem with testing, some folks will test positive for weeks after they've had COVID, after they've recovered. And we know those folks have some dead particles of the virus that are still in their body that can be picked up by the test. We don't know for sure, though. Could some of them still have virus that is contagious? Probably not, but there may be some. So if you're still testing positive, you probably ought to stay away from folks. Wear a mask to be polite to them, even if you're over that. For most folks, once you're well, then you can, after 5 days, you can stop quarantining. We'd like you to wear a mask for another 5 days just to be safe when you're out in other folks. So those are the CDC rules, but it's a lot more to come. We still are learning a lot about this virus.
Yeah, certainly wouldn't want to inadvertently pass it to anyone who's high risk. Dr. Winter, tell me about this. Exercise improves the effectiveness of vaccines. What do we know here?
This is a recent study that came out, Sonia. It said that if you exercise before and after you get the vaccine, maybe the same day, in fact, then it looks like your antibody levels go up higher. They explain this, well, if you exercise, your circulation increases, and the thought is that stimulates also your immune system. So I'm not sure how important this is, but you can certainly exercise when you get a vaccine, and it might make your results from the vaccine even more effective.
Yeah, I've been telling people at least some light stretching or walking, something to keep your body moving. Dr. Winter, thank you so much for your time today.
Thank you.